I just completed a course of Accutane a month ago, and I'm starting to get breakouts again. What should I do? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute, and we're a dermatology practice focusing only on the treatment of acne. So we're very specialized only toward acne treatment. So we have certain unique observations and experiences that we'd like to share with acne sufferers who are trying to navigate the path toward clear skin. So we hope you find this information useful, but remember, this is not medical advice. This is just for educational purposes only. So a common question comes up when patients finish their course of Accutane, they obtained clear skin, no more breakouts, they're very happy with the results, and then a month later, 2 months later, 3 months later, they start having pimples again. So first of all, why is that happening? And second of all, what do we do about that? So first of all, why is it happening? Well, Accutane is not perfect. It doesn't lead to a complete response that's long-lasting in 100% of patients. So there are different studies that look at how long patients typically are in remission or don't have acne after they complete a course of Accutane. So there's no definitive answer to that question, but generally, probably about 2/3 of patients who finish a course of Accutane stay free of acne. And any acne that they get after that is usually not very significant. But then there's that 1/3 or so group of patients that do get acne again. And that could happen a month later, 3 months later, 6 months later, a year later. So it's very individualized and it depends on each individual's circumstances. But when it happens, patients are very uncomfortable with that. And they're very unhappy that they went through the process of Accutane treatment. They had such a great reaction to Accutane. They no longer felt the emotional consequences of having acne. And then they get up one day and all of a sudden there's another pimple starting to appear. So what do we do about that? Well, it depends. If a patient just finished Accutane a month ago and starts to break out again, oftentimes what we do in our practice will resume treatment from where we left off. Maybe that patient needs a higher cumulative dose of Accutane. Maybe they need to be on it a longer period of time. So that's often something that we contemplate doing. And that could be within the first few months. If a patient comes to see us and they're starting to break out again a year later, then that's a little bit of a different picture. So in that circumstance, we talk about options. Depends on the severity of the breakout. Sometimes we use other treatments. Sometimes we need to go back and recommend Accutane again. And if we do, then we typically start over again from the beginning. So there are different ways of approaching that circumstance, and it's going to depend on each individual and the severity of the breakouts. And we decide on the best way to intervene at that time based on those individualized circumstances. Sometimes using things other than Accutane at that level can be productive and help a lot and help to resolve the patient's breakouts. But sometimes they're not effective enough, and sometimes we do have to go back and use Accutane for a second course. And there are some patients who end up using Accutane 3 times or 4 times. So some patients are very resistant to treatment with Accutane, and this can be because of a lot of circumstances. It could be because of their internal hormonal status. It could be because of other factors. For example, when somebody's under a lot of stress, they might start to have acne again. So there are a lot of different circumstances that can cause acne breakouts to reappear even after going through Accutane. And sometimes what we do is if a patient relapses the first time and acne comes back, the second time around, sometimes we'll use a higher dose or a longer treatment period, and sometimes we'll taper off very slowly. So instead of abruptly stopping the treatment after a patient reaches a certain point, sometimes we'll go little by little and taper downward over a longer period of time to keep them clear, and then finally stop. And sometimes we find that's helpful. So there are a lot of ways that we can address that problem, but it's, again, very individualized, and it's going to depend on each patient's individual circumstances how we handle that.